You're wrinkling the papers. I was driving home. This is several years ago after taking one of my children to a friend's house. It was in the evening. I remember it was dark outside. My route home was on some back windy roads, and I'm going along a well-known path, and there's a sign. It says road closed ahead. I'm like, okay, the road's closed ahead. And I keep proceeding on this same road, thinking, well, it won't be closed where I need to go. And I get to the point where the road is closed. And I'm like, what was that, Gina? Did you think the rules didn't apply to you? um, sometimes you'll see a sign that says no through traffic. So, you live in the area, you can get into where you need to go, but you can't get through. So I just remember being frustrated with myself and like questioning, why did I think that the rule didn't apply to me? I've always been a rule follower, especially when it comes to driving and road signs, but this night I found myself at a dead end and needing to turn around because the road was closed ahead.
Well, I had, in bringing that up, I had a situation. It wasn't as easy as yours. I was working when I was still in St. Louis, and this was a nighttime job, but it was across the river, and across the river was not the best place to be at late at night too, because it would the my shift I think ended at 11 or something like that, and the way I come, you have to cross over the Mississippi Bridge to get to where I was going. And to go back, of course, you have to do the same thing. Well, I didn't realize it when I got there, but the lane that I was going, the getting onto the bridge was closed. Now, the tough part about it was the area that I was in was not a very good area. And I had a group of young men in this area that decided they were going to try to capture me. And so I'm driving along and I'm trying to go. There was no way to go. They were behind me.
In a car?
No, they were just a group of men coming.
Walking, but you were in a car.
I was in a car, but I was trying to get on this bridge and there was no way to get on it. So I had to go past and go around the bridge thing, which was really scary because it was on a bridge. But luckily it wasn't too dangerous. I could get by it, but it was kind of scary because they were trying to, I had turned around and I was going back to try to get a different exit, and they kind of like surrounded me. Or not
Oh,
surrounded, but came in front of me. There was like a group of about five of them,
in front of you.
and I had to quickly turn around and head back and try to find my way out of that
Wow.
because it was a dead end street too. It was just an exit kind of ramp, but there was houses along this road, so it was kind of a scary situation. But I luckily got out of it, and luckily there wasn't a hole in the bridge that I would have fallen through because it was repairs on the bridge.
Oh, you actually went on the area where you weren't
Yeah, I had
supposed
to. I
to?
hadn't. I didn't have any choice, and luckily I was able to get through. But it was kind of weird.
Oh, wow.
So
That's
anyway,
scary.
so that's our wonderful story for today. Uh, so hello, I'm Don,
And this is Gina.
and we are with Focused Healthy Family, and this is podcast number 160. And today we're talking about rules and reality. So as we start, we want to start with our tip for the day, and again we're going with Caregiver 101 by Mike Collins, 101 ways to keep caregiving from making you crazy. And this is tip number 87. This is keeping things in perspective. Ask yourself if you have realistic expectations of your caregiving experience. What are your expectations of the condition, present and future, of the care recipient? What do you expect from the family members? What do you expect from the service organization? Unrealistic expectations that are not met increase stress dramatically. So, do we have a joke for today?
Um, so I found something kind of funny. Um, so it says, when I stepped on the scale at my doctor's office, I was surprised to see that I weighed 144 pounds. Personally, I would be excited to see that. But so I said to the nurse, why don't you just take off the last four? I joked to the nurse, and she made a notation on my chart. A few minutes later, the doctor came in, flipping through my chart, and said, I see you've lost some weight. You're down to 14 pounds. Just made me chuckle.
Well, I had one and now I'd lost it somewhere. I was going to try to find it and it went off my screen. So I don't have a second joke.
It kind
So
of fits the theme of
can't find.
rules and reality um, that we're talking about today, as it relates to healthcare in particular. I tried to find a joke specific to aging and healthcare rules, but no such joke was found. Um, But talking about, there's different rules. People tell you when you're in the hospital, these are the rules if you go to rehab. And this is a big one. So I pulled this right off of Medicare.gov. So when you're looking at going to a skilled nursing facility, it says Medicare Part A, which is also called hospital insurance, covers skilled nursing facility care for a limited time and a short-term basis if you meet all of these conditions. You have Part A coverage, and you have days left in your benefit period. You have a qualifying hospital inpatient stay. Typically, that means 3 nights or more, but there's other things that um, need to be met. You enter the skilled nursing facility within a short time, so within usually 30 days or less of leaving the hospital. Your doctor or healthcare provider states that you need skilled care, whether it's intravenous fluids or medication or physical occupational speech therapy. And you get the care from under the supervision of skilled nursing or the therapy staff. Um, and you get these services in a Medicare certified skilled nursing facility, lots of requirements. And you're receiving these services for an ongoing condition um, that was treated during your stay or a new condition that started. Um, and you need the skills of the facility to improve or maintain your current condition or to prevent it from getting worse. So a lot of times people are told, oh, I have 100 days at my rehab stay. This used to be kind of like what everyone was under the belief of. I get 100 days. What it is Medicare, traditional Medicare pays the first 20 days. And if you have a good Medicare supplement, it'll often pay the remainder. Sometimes there's a copay, sometimes not. And so people come with the expectation, it used to be they came with the expectation, well, they get 100 days. Why is it they can't stay here for that long of time? Well, their length of stay in the current environment, this is 2025 as we record this, is geared to be, you know, 20 days or less. And so a lot of places look at 7 to 14 days, depending on the diagnosis, depending on the plan for going home. And I don't know the exact specifics, but one of the places I worked at in the past, um, to get good rehab patients coming to the facility, their length of stay needed to be short to be considered, a good facility to go to. So they really aim to get people out the door in 14 days or less because it made a difference in the number, the patients, the quality of who was coming into the facility. They wanted those high level patients that were going to make good progress and going to go home and turn around, and then you have a bed for somebody else coming in. So there's lots of different factors at play. The other things that they might not talk about at the hospital is, um, this person has to be motivated. They have to be willing to participate in the skilled therapy services. Now, it's different if they're there for a nursing reason, like getting IV fluids or something like that. But typically, it's the therapy services that qualify them. And they have to be participating in the rehab. They also have to be making progress, and that's always been true. Even when people could more easily get up to that 100 days, if it wasn't shown that they were progressing with the therapy, that they weren't improving towards the goals, right? And so what are those things? Well, when the therapist assesses somebody, they set up these goals. Being able to walk, a certain distance, being able to go to the bathroom by themselves, to be able to put their own clothes on. And again, all of this depends on the environment when they go home. Are they going home alone? Are they going home with help from a family? And so if this progress is not being shown, this length of stay can be shortened. Enter managed care. So now you have options. You have HMOs, managed care, Medicare versus regular, original Medicare, straight Medicare. It has these different names. So I went to another Medicare website that talks about the comparison, but it leaves out so many things. So with traditional Medicare, with your supplement through Medicare, you get those 20 days, and that's typically not fought. Again, it depends on the facility. And then you can get, additional days that are covered subject to the copay. But with a managed care plan, they are on top of getting those people out the door as quick as possible.
Well, can I stop you? Just one thought. I'm just going to ask you. You mentioned if they're not cooperating, they actually shorten the stay.
If someone is continuing to refuse therapy services,
Huh.
like adamantly refuse, then they're not going to continue to pay for it if you have, refused there. So that's why we as therapists do everything in our power to motivate people. But this is often where you run into, even though we can motivate them, try to get them to do something, um, they might not be showing that progress. But yeah, if someone refuses over and over
Hmm.
again, we often have family meetings when that happens, and they come in, they talk to their loved one. You've got to participate. This is what you need to do, to go home. But yeah, if you're refusing to participate, then
Hmm.
certainly they're not going to want to pay for that, because what skilled therapy services are they getting if it says
Yeah.
refused, refused? Um, so yeah, there's so many different factors that people don't realize. They think, oh, the therapists are just not doing enough. They're not pushing them. You need to get them out of bed. You need to do this, and then you go to see the patient, and they adamantly refuse you, and they do have a right to refuse. And sometimes they think magic is going to happen. Therapists have fairy dust, and we're going to do things that will make you get better. And
Harry Potter wand you carry along.
um, the person's participation is so much a part of their recovery. Um, so when you look at, talking about these managed care plans, so I see it all the time. Someone gets told, you know, it's Thursday, and they're told, Monday is your last covered day of services, which means you've got to be out the door on Tuesday, and or sometimes even shorter than that. And they're like, and they can appeal, right? So they can appeal. But what happens? That
Huh.
appeal takes time, and if they lose that appeal, those days that weren't covered, they're left paying the full
Hmm.
cost of staying at the
Because
facility.
it doesn't happen one day. That appeal probably takes a day or two
It
at least.
it does, and it's a process to do it. And sometimes you can get okayed with the appeal, and sometimes not. Sometimes you can find out before. I know a lot of times we're like, is this person going home today? Are they being discharged? Oh, wait, they won their appeal. They're going to stay a little longer. Oh, they lost their appeal. They are leaving now. Or someone who's able to pay privately to stay in the bed, so paying the facility for that cost. You can get therapy services under outpatient Part B services. Um, and again, there's, subject to co-pays, but it's a tricky process, and people don't realize they're enticed to sign up, excuse me, for these managed care plans because they offer things like dental and vision and hearing, which are not offered under traditional Medicare plans. They have um, prescription drug plans, which you can get under original Medicare. You have to pay an additional amount to have that coverage. And so there's so many different companies out there providing these plans that they're marketing, they're advocating that these are great plans. If you come with us, you get this benefit and that benefit and this benefit. and we can do all these different things. Excuse me. But then the reality is now all of a sudden you're in rehab and you know,
They're
you get
not covering what
77
you need.
days and they're saying you need to go home. And I see this and people live alone and they're not fully independent yet. We don't feel they're quite ready to leave. And yet the insurance company is dictating.
Mm.
Um, so yeah, just looking at this website, Medicare interactive.org. So not sure if this is it's a comparison. It says with original Medicare, you can see any provider. With HMO plan, you have to see an in-network provider. Um, Original Medicare, you can visit doctors anywhere in the US. With the managed plan, it has to be doctors within your service area unless emergency care is absolutely needed. With original Medicare, you don't need a referral to go to specialist. Um, but with the managed plan and HMO plan, you typically need a referral to specialists. Again, traditional Medicare does not cover vision, hearing, or dental services. Many HMO plans do provide those services. Again, traditional Medicare, you have to sign up for an additional what's called Part D to get prescription coverage. Um, Most HMOs have an included prescription plan.
When you talk about HMO, I mean, do they still use that terminology? Because when we talk, like I'm on a supplemental plan. They now just
You're
really call it a advantage or a supplement plan.
Yeah,
They don't really
Advantage, the
call it, but
Advantage
it's
plan.
basically the
That's
same
what it
thing.
is.
Yeah.
It's a managed plan. You have one through one of the many companies. And again, the selling points were dental,
Hmm.
vision coverage, um, lower cost overall. Now we did take the initiative to add riders.
Yeah.
So we
Because
added because if when Don went in the hospital with his plan, only 80% of it was covered. If he had traditional Medicare, 100% would have been covered. So we added a rider that it paid an additional $350 per day. We're
yeah.
still, though, trying to sort this out. It's now what, 5 months later?
Well, I
And
to put on their side, I didn't send the right paperwork in. Now,
so
I
it's
thought I
complicated.
did,
So
but it is
it's
complicated.
complicated, right?
And
And you didn't get the bill from the hospital till recently. It's been almost 5 months.
yeah,
Then you have to submit paperwork. You have to submit the right paperwork. We're not seeing that 350 per day like they specified when we signed up for this plan. And looking at additional therapy services, outpatient therapy services, looking at copays that we might not have had we choose a traditional straight Medicare plan. And
well,
so, we added additional things on because I knew,
well, that comes really to the
excuse
what
me.
we're talking about is getting that an advocate that can come in and tell you these things. Because you think about it, one, you're in a hospital, you may not be feeling the best, and you got to make these decisions, and you got to decide on, uh, and I remember even with being in there, and they come for therapy, and you're like, I don't know if I can do it, but I did it, but it wasn't always easy and so you got to come up with that and not refuse and be able to come up with
Well,
the.
you were in the hospital.
Well, yeah, I know. I'm just saying
Yeah,
that
you weren't
but I
in.
mean, think about anybody that's even in a nursing home or rehab or any of that. There's days when they have to think through all of this stuff. And if, like you say, if they're alone, if they don't have somebody at home or somebody that can be there for them, how do you know all of this stuff? It's so complicated.
Well, and they want to, it's cost saving measures. So healthcare has, they used to, if you had a stroke or something, you would go to the acute rehab hospital. So it was a hospital with rehab focus. I worked at one of these, my first job, and you had round the clock doctors, but the focus was rehabilitation. You had 3 hours or more of therapy a day. Well, then they decided, well, if we do rehab in a skilled nursing facility, it's less costly. You don't have a doctor around the clock, but you have nurses around the clock, and it's a lower cost. So now, someone who maybe has a stroke, if they qualify and they can do all the criteria for short term rehab, maybe they'll get 2 weeks there and then they go on to the nursing home for additional rehab, or they don't even get that hospital rehab. And so they've learned, okay, it costs less to do that. Well, then you can get therapy at home through home health agency. Well, that costs even less, right? It costs the system even less. And, just look at, um, I was born in the late 60s. And when my mother had both my sister and I think she got about a week in the hospital. Right now, you have a baby, you get one overnight stay, at least typically.
You
Haven't had
don't
a
get
baby in
kicked out.
16 years. Um, and so they've learned getting people out of the hospital sooner is better. Well, sure. It used to be people laid in bed for weeks or longer, right? They learn that getting up and moving is important for healing. And yet now they're pushing people out of the hospital so quickly that I am seeing this everywhere I work. People come from the hospital and then they turn around the next day or within a few days and go back because of a complication, because the nursing homes are not designed for significant medical issues. They have a drop in their hemoglobin, they need a blood transfusion, back to the hospital, something else happens. And so this recidivism going in and out, back and forth to the hospital is costing them more. And yet the reality is they want to reduce those costs. And yet they have this system in place that's, to me, it seems silly. You're getting people out of the hospital so quickly. They come to us for therapy. Usually we see them the day after they get there and they're exhausted and drained and they've had moving from the hospital to our facility and it's a lot on them. And now they've got, a week, maybe two to recover and get better.
Right.
And, there can be confusion, agitation coming out of anesthesia after surgeries and different pain medications and things that can complicate things. And you want to go to the nicest rehab facility. Well, those are the ones that are pushing for the shorter lengths of stay because they need to show that they have a low length of stay. For hospitals to say, yeah, this is a good facility, we want you to go here. To get, and they're aiming to get people who are going in for elective surgeries. That's kind of the ideal someone. I'm going to have my knee replaced, I'm going to have my hip replaced, shoulder surgery, and then I know I need this rehab. Obviously, most of the people that come through are not planned because most of it is accidents and other medical conditions. But there's just all these factors at play that make this messy, in my opinion. I've
Very messy.
watched this and the changes, and it's like, okay, and they keep calling them patient advocated changes and plans, and it's all in that. The framing of this is in the patient's best interest,
And it's not.
and I'm over here going, no, this is not. It's
Yeah.
all about
It's
cutting
called
costs.
it's
And
called
then
corporate
things they're doing are not really, it's saving money. Like I'm like, when is someone going to stop and go, these people who go back and forth from the hospital to rehab, sometimes two or three times. And you wonder, would they have not been better to stay a few days more in the
right.
hospital and get more proactive therapy in the hospital, getting up? Because it is important to get up and to move around. The
Hmm.
longer you stay in bed, the more time it takes to recover and heal. But you can read the rules, you can look things up online, you can talk to your representative, you can find out what the rules are. But then you get into a situation and
Where the rules don't fit.
well,
They
and
are.
then there's other, things that apply and they're not always written down, they're not always clear cut. It's not always super concise. Um, some other facilities, it's easier to have a longer length of stay. But again, you're looking at the quality of the facility and some differences in that. So things to just keep in mind and the importance of having an advocate, having
Hmm.
people to support you. Because like you said, you go in the hospital and they're going to ask you, do you have someone to care for you at home? Well, what that means is they're either going to send you home or to rehab. So you have to know to say, no, I can't care for this person at home right now.
Hmm.
But you also say the plan is short-term rehab to go home because some of the short-term rehab places, they don't have enough long-term beds and they're not going to take you if they think you need full-time long-term care. So that has to be specified. I ran into this with my dad and and then he was on psychiatric medicines, but they didn't put down his dementia diagnosis. And so they were questioning, well, why is he on these different medicines? Oh, well, he doesn't have the dementia diagnosis written down. It's like, okay, that's really important that that's there. So there's just different factors that people can get turned down and denied to go to certain facilities or
Well, and
access.
we had you knew the system, and that made a big difference. But like I said, we get back to
But
people that don't.
it was still
Yeah,
frustrating. Back from when you were 52 and you had your first heart attack, and
minimum.
I was told by the doctor, you're going to get rehab. It's automatic.
But
Well,
you had to fight for it.
well,
Yeah,
it's not automatic. There has to be a written order for it. And some places might have standing orders for different diagnoses, but you weren't getting the therapy services. And I knew if there was no order for it, it wouldn't happen. And I had to push and I had to raise a stink. I, remember getting kind of angry. And of course, then it's the weekend. Well, we don't have anybody that's here on the weekend. And yet they didn't want me getting you out of bed. They didn't want me
yeah,
checking your blood pressure and things. Years later, when dad was in the hospital, I just did things and I just got my dad out of bed. I rearranged the room, and most places were appreciative.
yeah,
Occasionally, I'd have someone walk in and say, why are you getting them up? What are you doing? And I'd tell them my background, and they were
yeah,
happy to have that additional help.
yeah. They didn't have the help.
And
Yeah, they always,
especially because with my dad's dementia diagnosis, he really needed more one-on-one attention. But it's a difficult system, and the rules are changing. And what someone tells you may not be the full picture of what you're looking at. And we also have to realize that the people that are in these positions to give you the information in the moment are very limited in how much time they have to spend with you. A social worker who used to have more time to spend with families and planning, they have all these people that they've got to do this paperwork for to set up for rehab that they have very little time to do what they need to do.
yeah.
And, we can get mad and frustrated with the people in place, but um,
It's more the corporation. It's more the
well,
upper
yeah,
end
and
that
it's
really
it's
needs to be.
there's so many. What I always got frustrated with in the hospital is each department was often really good, but the communication between
Then,
them didn't
yeah,
always happen. And so we were left, waiting and having to be that person who communicated the
we
information.
did that with mental health too. So it's a yeah.
And, it's frustrating. And it's in an ever-changing system and it's different in different places. And it's so important to have someone, even if you're young and fully competent and you go in the hospital, to have someone to help you advocate
Mm.
and to write things down, if or you write them down because you're not going to remember everything they tell you. When they come in to see you, some doctors don't spend a lot of time, and um, you want to have your questions written down ahead of time. I know the other frustration I had was what time doctors would make rounds. And I know when you were in the cardiac unit
6:30 or
back
something
in
like
the
that. Yeah.
Charlotte, I had to be there by like 6:30 a.m. At places I've had to be at 8 a.m., but then the doctor didn't come till 2. And so things are always changing in the hospital.
Well,
And
and at the time you had kids that you had
oh,
to deal
sure,
with. So yes, it goes. This
juggling
is
all
so
those.
complicated, but
So just, having other people talking to, I had friends have reached out to me, their loved ones needed to go to short-term rehab and just, helping them with this information and working one-on-one with families and people, to support and advocate. And you can change your Medicare plan every year. And I think October, there's open enrollment that you can change it for the new coming year. If you move and you're in a different area, um,
it'll change depending on if it's the same.
if you're
Like
on a managed plan or whatever. Um,
because the states all have
Oh yeah, different states
different
have
versions.
different
So if you
plans.
move out of state, it could be a whole nother. I mean, Medicare is everywhere, but
But if you
all
have
the additional
the
stuff
managed
and
plan like you
yeah,
have is can be unique to a particular state. So there's lots of questions and you don't even always know the questions to ask. And that's, I'm putting together this pamphlet or small book from hospital to rehab to home to kind of addressing some of these different things. And that's, when I work with you one-on-one to help you know what questions to ask and what to be prepared for and what your options are with different situations and knowing what you can do because yeah, Rules are changing. Sometimes there's a blocked road and you can't get through an area where you thought you could. And sometimes you can get through
Sometimes you have to get through
anyhow on a
anyway.
bridge when you're being chased by people. And,
Yeah.
or sometimes you've got to turn around and restart, and it could set you back and make other things in your life more complicated when you have to navigate. We talk about the sandwich generation and juggling raising kids. And my experience, so Don's had two major heart attacks. The first one, our kids were
Pretty young, because
2, 9, and 13. And the last one was just this past year. So they were 15, 22, and 26. And it was a very different experience. The second time around, we had two kids who drove. Um, it was easier to navigate them. We also had my mother who lived close, and it was a different process of navigating the journey. And yet it didn't mean I didn't still have responsibilities, even though those kids were older. I had one in school, um, that we had to provide transportation to get her to and from her high school. Um, and at the same time, our middle child had gotten in a car accident like the day
oh,
before you
that's
went
right.
in the
Yeah.
hospital, and we were navigating insurance, to
Well,
deal with
and the
that.
oldest one stepped in and helped out in that, so that you had
That's a story of itself.
yeah.
So we often have, different things going on in our life and different factors that are at play. And, then where's ourselves, and when are we taking care of ourselves? When are we taking some time, whether it's taking a short walk while someone's in the hospital, either in the building or outside, going to sit with someone who comes to visit and enjoy lunch outside of the patient's room. One thing we have to realize, and it took me a while with my dad to realize, he's the nurses are there. They're there to care for him. I can go down to my mom and I would go and get lunch, and we'd sit by ourselves for a minute because we needed that. And people
Self-care.
can be needy and want someone with them all the time, especially an older person and someone who's got some confusion, and you want to be there for them all the time. Yet it's exhausting if you're not taking care of yourself. And you think in the moment, you get all this surge of energy, the adrenaline kicks in, and you can handle things. And then down the road, your
It kicks in on you.
your immune system is depleted. I know I got um, sick one of the times. Someone was in the hospital, and I had to stay home and spend some days at home because I was just depleted. And um, so it's a balancing act, right? And understanding how the system works, and it can be different than what you think it is, or people don't give you all the information. Sometimes in the healthcare world, we forget these underlying things that the average person doesn't understand or doesn't know. And having that additional information that's not outwardly spoken, or they think somebody else told you this already.
Well, and it kind of goes back to what we've talked about for a long time is making some of these conversations a little earlier, you
Yeah, it
know,
can make it a whole lot easier if you
getting the
talk ahead of
questions down
time.
beforehand of what to ask and getting some of this information out. It's not easy to do, when you're dealing with a senior and you're trying to talk to them about some of these things. It can be difficult, but at the same time, if they can be part of it versus waiting till they're incapable of making those decisions, it's best to try to do it as early as possible.
Yeah, one thing we put into place, my mom, someone kind of advocated, some meeting or support group she went to, that if something happened to my dad, I was 45 minutes away at that time.
Mhm.
Um, me or Don could be there within, a reasonable amount of time, but identifying neighbors who could come
Well,
in the event. Maybe something happened to her and someone needed to come sit with him, that she identified some neighbors. And, she was reluctant. It's difficult to ask people for
mhm.
help, but if the help is, listen, can you come in the short run, knowing that my daughter or son-in-law can be here likely within 2 hours or less, that it's just that intermediate time that's needed. Because yeah, you're caring for somebody. What happens if something happens to you and you're their caregiver? What is your plan B? What's the next step? I saw someone recently in short-term rehab, and her spouse had, I believe it was Alzheimer's, and she had a camera at home, and she didn't really have other support. And she would go to the grocery store and she'd be watching on the camera. And if
Mm.
something happened, she'd just leave. And the people at the grocery store knew if she just left her groceries and left, it's because she had to go take care of her husband.
Yeah.
And that was the system she had in place. And for a lot of people, the reality is we don't have the money to spend on someone to come in. We don't think we have the support and services. Well, there can be grants out there, there can be additional funding, there can be other things like adult daycare settings and other just getting support from church members or other community members to come sit with someone, looking at different options. But yeah, because it can be depleting. I'm curious, Don, just to ask you one last question. When you were in the hospital, what kind of hospital-wide systems can you think of something that really bothered you, something you didn't understand?
The gloves.
The gloves?
Well, that was just that. Remember I think it was my
Oh, it
first
was the
time.
plastic.
The constant, this constant, put every time they come in, they put on. I don't know,
Well,
but
you
yeah,
talked
that
about the
was, but
plastics. They use so much plastic because everything's sterile and it had to be
yeah.
wrapped. But it's just as far as the function of things.
Well, I mean, it would take a while for nurses to come by because they were so busy, that, and I didn't blame them, but it was, sometimes we had to go to the bathroom really bad, or he had to do something. I had the catheter on, so that didn't bother me. But you'd call him for anything, even at the middle of the night, and it would take him forever to get to you a lot of times. So that's one thing that bothered me. The doctors, they're in this thing all the time, and so I guess they get kind of callous to. You don't get a lot. One, you don't see them a lot. You'll get them one time a day maybe, and they get in, they get out, and it's a little bit calloused in as far as some. I've had some that have been good that will take some time, but a lot of them don't. They want to get in, check you out, make sure, and out. You know, and so I guess our system is just, it's so big that it causes them to have to not be able to give the time that they need to give. But
And like, yeah, sometimes doctors don't even know the full policies of the
yeah,
hospital. I know some places we've been to, the doctors kind of work independently. They're not employees of the hospital, right? And so there can be differences. So lots of questions, things to consider, whether you are just thinking about the future, what could be, how can I have things in place, or you're in the middle of it and you're having to jump in right now. That's where I'd love to come in and help you. You want to let the dog out real quick?
well, I was going to try to
No, I
finish
was
up.
going to pause this and then, well, can you just delete the section? So that's our podcast for today. We hope you've enjoyed it. We'd love to hear from you. We'd love feedback. Please leave us a comment, like us on whatever platform you're listening to us today, and share this information with others. You can listen to us anywhere you listen to a podcast. You can also watch on YouTube, and please share those links with other people. Look at our website to see how else we can help you, answering questions on Ask the OT, consulting with Don and I to work with you one-on-one for your situation. Join Don. He's now doing every Tuesday night, 7 p.m. Eastern Time. He's doing a short EFT tapping session for anybody to join in as a group. You can learn more about EFT and tapping and how it can help reduce your anxiety. You can learn more about that on our website as well. Again, see all this at focusedhealthyfamily.com. Find us on Facebook at Focused Healthy Family. Our Instagram is Focused Healthy Family 1, and YouTube is Focused Healthy Family. Join us every Thursday when we provide another podcast, whether it's Don and I discussing a topic or us having a wonderful guest on that we interview on a variety of topics. Look back to our former episodes. And remember, how you speak to your children and your loved ones today shapes their future and yours.